Bismillahirrahmanirrahim. Assalamu alaikum. This is Amnadan with my group fellows Zumra Naeem, Hafiza Hafsa Nawaz, Rabia Basri, Zuhaib Ahmed, and Tawassal Mehdi. Today we are here to explain about hypoxia. So let's start. Hypoxia occurs when oxygen is insufficient at the tissue level to maintain adequate homeostasis, stemming from various causes such as hypoventilation, ventilation perfusion, or right to left shunting. This condition can arise from inadequate oxygen delivery to the tissues due to either low blood supply or low oxygen content in the blood, also known as hypoxemia. Hypoxia can manifest across a spectrum of intensity ranging from mild to severe and present in acute, chronic, or mixed acute and chronic forms. The response to hypoxia varies among tissues. While some tissues can tolerate certain forms of hypoxia for extended periods, others are significantly impaired by low oxygen levels. As far as the history of hypoxia is concerned, the word hypoxia has recently come to attention to the general public on two occasions. The 2019 Nobel Prize in Physiology was jointly awarded to William G. Klein, Sir Peter J. Breathless, and Greg Lee Semenza for their discoveries of how cells sense and adapt to oxygen availability. They identified the molecular machinery that regulates the activity of certain genes in response to varying levels of oxygen, especially when oxygen is lacking. Key molecules were discovered and their action described: hypoxia, inducible factor, von Hippel-Lindau protein, and prolyl hydroxylases. As far as the definition is concerned, hypoxia is formed from the Greek hypo, which means under, below, less than, and oxis, which means acute or acid, that gave oxygen. Anoxia with the prefix an, that means absence, lack, suppression of oxygen. In the Webster's New World College Dictionary, it is defined as an abnormal condition resulting from a decrease in the oxygen supplied to or utilized by body tissues. Another definition says it's the total deprivation of oxygen. Moreover, it can also be defined as oxygen deficiency causing a very strong drive to correct the deficiency. However, anoxia can be defined as severe hypoxia, absence of oxygen in inspired gases or in arterial blood or in the tissues. Now let's just discuss the types of hypoxia. Best and Tyler classify hypoxia into four main types: hypoxic hypoxia, anemic hypoxia, histotoxic hypoxia, stagnant hypoxia. To this listing, a newer and fifth type of hypoxia may be added. It is known as fulminating hypoxia. First of all, let's discuss hypoxic hypoxia. In hypoxic hypoxia, there is a lack of oxygen in the arterial blood. The oxygen tension is lowered in both the lungs and the arterial blood, and the hemoglobin is not saturated with oxygen to its normal extent. This type of hypoxia affects the body as a whole and is one of the most serious forms of hypoxia. Hypoxic hypoxia is often produced by low tensions of oxygen in the inspired air, as is seen in high altitudes, breathing of inert gases, and the inhalation of anesthetic agents. Abnormal lung conditions may also produce hypoxic hypoxia. Emphysema, asthma, pneumonia, or pneumothorax encourage the formation of this type of hypoxia. Mechanical obstruction of the airway by foreign objects, rhinospasm or bronchospasm, inhibits the flow of oxygen from the atmosphere into the lungs, creating a state of oxygen want. Shallow respiratory movements from any cause, with either a decrease in rate or amplitude, may cause hypoxic hypoxia. A chronic state of hypoxic hypoxia may result from a patent formant ovale and other embryological malformations of the heart and blood vessels. Now let's come towards anemic hypoxia. The arterial blood contains oxygen at its normal tension in anemic hypoxia, but there is a shortage of functioning hemoglobin. Anemic hypoxia on the whole is less serious than hypoxic hypoxia. However, it does affect the whole body. Anemic hypoxia may be caused by acute or chronic hemorrhage, primary or secondary anemia, alterations in the hemoglobin of blood caused by nitrates, chlorates, or coal tar derivatives, and carbon monoxide poisoning. The very next is stagnant hypoxia. Stagnant hypoxia is due to a decrease in the rate of flow of the circulating blood. Local regions of the body are usually involved, but it may affect the entire body. The blood is saturated normally with oxygen and the oxygen load. as well as the tension under which it is held, also may be normal. Hypoxia is produced because of the amount of oxygen reaching the tissues is inadequate. Now, the fourth one is histotoxic hypoxia. As the term suggests, the tissue cells are poisoned and are unable to accept oxygen from the capillaries. In this type of hypoxia, the cells are not able to utilize the oxygen, although the amount of oxygen in the blood may be normal and under normal tension. Histotoxic hypoxia is produced by cyanides. Theoretically, it may be produced by any agent which depresses circular respiration. Here, last but not the least, is fulminating hypoxia. Fulminating hypoxia is a newly recognized form of hypoxia. It is a very rapidly induced type of hypoxia caused by the inhalation of undiluted inert gases such as nitrogen, methane, or helium. In anesthesia, fulminating hypoxia may be produced by administering nitrous oxide anesthesia without the simultaneous use of oxygen. If we look at the causes of hypoxia, it is most often caused by an underlying illness that affects blood flow or breathing. Conditions that can lead to hypoxia include anemia, asthma, bronchitis, chronic obstructive pulmonary disease, congenital heart defects, congestive heart failure, emphysema, pneumonia, pneumothorax. The possible and apparent effects of hypoxia upon the body are: acute hypoxia produces acceleration of the heart rate. Let's talk about the diagnosis of hypoxia. The first clinical sign noted in the hypoxia patient is cyanosis. A bluish discoloration appears first in the capillary beds of the mucosa of the lips and lobes of ears. Pulse oximetry. Healthcare providers places a sensor over finger to measure the amount of oxygen in blood. This procedure is non-invasive and painless. Arterial blood gas test, ABG. A thin needle is used to draw blood from wrist, arm, or groin to check oxygen levels. Pulmonary function test, PFT. You blow out and breathe in to a mouthpiece attached to a machine that measures how well your lungs work. Imaging. X-rays, CT scans, and VQ scans all use special equipment to get images of internal organs. Imaging can help you provider determine the cause of hypoxia. 6 minutes walk test. You walk on a flat surface for 6 minutes to see how far you can walk in that time. This test helps your healthcare provider evaluate lungs and heart function. Now, if we talk about the treatment of hypoxia, it is prevention is the best treatment. The treatment for hypoxia depends on the underlying cause. The cause might be a one-time event or it could be an ongoing condition. Treatments might include inhaled steroids that can open up your airways to treat asthma or other lung diseases. Medications that help to reduce excess fluid on the lungs. Continuous positive airways pressure mask to treat sleep apnea. Supplemental oxygen to treat ongoing hypoxia. An oxygen delivery device is attached to your nose with a mask or tubes to increase the amount of oxygen getting into your lungs and down to your alveoli. Mechanical ventilation in a hospital in circumstances of severe acute hypoxia. Thank you so much, everyone. This was all from our side. If you have any question, you may ask.